Health is wealth, hence, any slash to items in the DOH's proposed budget is perceived as anti-public or anti-human. And today's verbal exchanges in the House budget hearing turned up the heat as arguing parties raised their voices to drive home their points. PTV correspondent Mela Mores has more details on today's DOH budget hearing.
During today's deliberations of the House Committee on Appropriations on the proposed 2024 budget of the Department of Health, DOH Secretary Teodoro Herbosa assured that they will further intensify their health services and programs in the country. For fiscal year 2024, the DOH is asking for a little over 311 billion pesos in funding next year.
We want to have better health outcomes with longer life expectancy, stronger health systems that are resilient against pandemics, and access of all Filipinos to all levels of healthcare.
Amid the hearing, some lawmakers had a heated exchange when budget cuts for certain DOH initiatives came up.
Ganito po ba sa bagong Pilipinas na yung health po natin and social services, yun yung kinakaltasan. Kaya Madam Chair, I also echo the sentiment of other colleagues natin na hindi dapat ganito sa DOH.
I would find it unfair on the part of the administration being wrongly accused na maraming mga programa sa kalusugan ang tinapyasan. Because this is a budget briefing. Hindi po pwede na meron tayong drama na pinapalabas natin na lahat ng programa ng kalusugan ay tinapyasan and making the administration look back where in fact it is not true.
Meanwhile, as one of the attached agencies of the DOH, issues on PhilHealth were also discussed. The state insurer vowed to pay its millions in debts to hospitals in 3 months.
Napakarami po ng mga hospital na hindi na tinatanggap yung mga indigent patients dahil daw po maraming utang ang PhilHealth sa kanila. And then marami rin po na hindi na raw po mapasweldo yung mga kanilang pong mga staff, frontliners, dahil po malaki ang utang ng PhilHealth.
We will completely, hopefully, or very high percentage po within 90 days, no? Yung 27 billion po. You can pwede yung naka-record naman to, 'di ba? So, within 90 days po, we will try to pay a very high percentage of the 27 billion. We are already preparing. We had a meeting, our Execom had a meeting yesterday, no? We are preparing to use the DCPM formula, no? Yung debit credit payment mechanism formula.
Also, PhilHealth had to explain the salary increases in their agency amid the pandemic.
Our salary was increased based on an EO, an executive order, 150. Even before we were allowed to pattern our salaries on this EO, we actually applied to the GCG and we have the certification process and we went through this and we were approved.
Mela Mores for The Nation.